This is Jeremy with Clarity. And in this video, we're going to be going over the hemipelvis, also known as our os coxa, coxal bone, or innominate bone. Two of these innominate bones help to contribute in forming one pelvis, which is completed by our sacrum, our left and right sacroiliac or SI joints, and our pubic symphysis or symphysis pubis. The pubic symphysis sits between our left and right pubic bones. Specifically, it sits on the symphysial surface of each pubic bone, respectively. That forms a secondary type cartilaginous amphiarthroidal joint, with secondary implying it is made up of fibrocartilage rather than hyaline. However, that only covers the anterior articulation of the pelvis, as we also have our two posterior articulations as the left and right SI joints. On this hemipelvis, we can see the two main articulation areas of our left SI joint. Here we have the auricular surface of the ilium, and here we have the iliac tuberosity. The auricular surface of the ilium articulates with the auricular surface of the sacrum to form the anterior-inferior 1/3 of the SI joint, which is a plane type synovial diarthroidal joint. Auricular means ear, and that's exactly what this surface looks like. And that may help with differentiating this surface from the iliac tuberosity. The iliac tuberosity articulates with the sacral tuberosity thanks to the interosseous sacroiliac ligament that sits between them, forming a syndesmotic type fibrous amphiarthroidal joint. Therefore, we can see that one pelvis is made up of three articulations. Not only that, but one pelvis is made up of three bones, and two of those bones are innominate bones made up of the fusion of three different individual bones: the ilium, the ischium, and the pubic bones, named in order of decreasing size and contribution to the hemipelvis. These three bones have one main fusion area, known as the acetabulum. The acetabulum represents the point in which the femoral head articulates with the hemipelvis to form a ball and socket type synovial diarthroidal joint. However, that's not the only point in which these bones come together, as the pubic bone and the ischium come together to form the obturator foramen, and the ilium and the ischium come together to form the greater sciatic notch. The obturator foramen is named after the obturator nerve and the obturator vessels, which travel through the obturator canal, which is on the superior lateral aspect of the obturator foramen, thanks to the presence of an obturator membrane that sits here. The greater sciatic foramen, or the greater sciatic notch, which becomes the greater sciatic foramen, is made of the ilium and the ischium, because the ischial spine demarcates the point in which the ilium ends and the ischium begins. Inferior to this ischial spine, we have the lesser sciatic notch, which is of the ischium only, and that lies between the ischial spine and the ischial tuberosity.